Good afternoon, everybody. It's me again. It's Russell Mills. It's March 16th, Monday. I want to say hello to everybody. Hope everybody's blessed. I want to find out what's going on with this coronavirus thing that's everybody's been talking about. I'm on my phone right now. It says number of coronavirus cases rises to 138 in Massachusetts. Is also announced Saturday was the first cases in Worcester and Barnstable County. Says the number of corona cases in Massachusetts risen to 138. Health officials announced Saturday up to 15 from Friday. It's the second consecutive day of a 15-person increase. The Commonwealth also announced Saturday was the first case in Cape Cod and Worcester. It says update Sunday, March 15, 26 more cases were detected, bringing the total to 164. So the number of coronavirus cases in the Massachusetts has risen to 138. Health officials announced Saturday up to 15 from Friday. It's the second consecutive day of a 15-person increase in Commonwealth. I live in Massachusetts. Also announced Saturday were the first cases in Cape Cod and Worcester. Says the announcement from the Department of Public Health came shortly after Governor Charlie Baker and the state's health commission announced the establishment of the new COVID-19 response command center that will help correspond Massachusetts lab testing and quarantine, among other things. It says as of Saturday, a total of 475 people have been tested for coronas by the state labs. Officials said with 138 people testing positive corona-19 so far. 19 of those cases have been confirmed by the U.S. Centers for Disease Control and Prevention.
The new developments tonight. Also tonight, the number of cases related to the outbreak rose here in Massachusetts. The state releasing new numbers today. There are now 138 coronavirus cases here. 104 of those are connected to the Biogen conference at the Long Wharf Hotel in Boston, and that number includes the first case in Worcester, which is also connected to the conference. We have complete coverage of all the latest developments here in Massachusetts. Diane Cho. Students at Northeastern live with reaction from students at Northeastern who are told today they need to move out. Joy.
Well, Christy, here on Northeastern University's campus, students are scrambling to pack up and move out after getting notice to do so really just hours ago.
It was definitely last minute.
The rush is on to relocate.
We kind of just got the email and then like 5 minutes later started packing up our rooms.
Students at Northeastern University notified in this email Saturday afternoon that they're to move out by Tuesday.
Well, we were surprised because they told us that we weren't going to be kicked out like earlier this week, so it was a surprise email.
It's the latest local university to close campus in response to the coronavirus pandemic.
Everyone was really anxious, and all my friends are really anxious. Crazy time.
The move comes days after the university moved its classes online.
I guess I was shocked because up until now, it kind of seemed like we had the option to move out or not.
Harvard, Boston College, and Boston University are among several others that took similar measures this week.
It's just crazy. We thought we had more time.
Northeastern students say it all seemed so sudden.
Yeah, we were definitely just throwing stuff around and like we're all like going home in different ways.
But they also agree safety is the top priority.
I think it is probably for the best, especially like with the state of Massachusetts right now.
Now, it's still not clear when operations might return to normal here on Northeastern University's campus, but of course we'll follow all of the latest developments. Reporting live from Boston, Joy Lim Nakrin, NBC 10 Boston.
Thank you, Joy. Also today, Governor Baker announcing a new command center to respond to the coronavirus. The state is also expanding who can be tested for the virus. The governor saying today the new steps give the state more ammunition to fight the outbreak.
And we are preparing for more confirmed cases to occur.
But Governor Charlie Baker says the state is now even more ready to fight the COVID-19 pandemic.
Starting now, we're standing up a coronavirus command center.
You'll find that command center inside the Department of Public Health headquarters in downtown Boston. That's where officials armed with $15 million are now working to plan quarantines and do whatever else it takes to combat the outbreak.
This team of experts will focus solely on pushing back against this disease and on expanding testing capacity and distribution and quickly responding to the needs of our communities.
As of Friday, the state tested 475 people for COVID-19, but it'll now double the number of tests each day to as many as 400. That's because healthcare providers are now able to send patient swabs directly to state labs without getting clearance first. 3 commercial labs in the state also now have FDA approval to run tests for the coronavirus, but the state says that's still not enough. It is critical that more labs be approved by the federal government and come online in Massachusetts. And we continue to urge the FDA and CDC to help us expand our testing capacity. As for what you can do to help out, Baker says don't go overboard at the grocery store.
Filling your basement with 2 years worth of canned soup just means your neighbor will have to go without.
And a reminder, if you have questions about coronavirus, the state now has a hotline. Just call 211, or you can search online at mass211.org. The service is free. The hotline is available in multiple languages and is staffed 24/7. Also today, the White House is expanding its travel ban on people arriving from Europe to include the UK and Ireland. NBC 10's Diane Cho has the latest from Logan Airport on what travelers are saying about all this.
Helen Ryan says her son was having the time of his life studying abroad in Madrid, but found herself picking him up at the airport a lot sooner than they expected.
For the safety and wellness of the students, they decided to cancel the programs and make sure everybody arrived safely back to the United States.
His trip suddenly cut short because of growing concerns about coronavirus.
This week, everything changed and really ramped up, and the alert level ramped up, and the need to get him home became urgent.
Today, President Donald Trump announcing the UK and Ireland have now been added to the European travel ban for foreign nationals.
That's probably a good idea. I mean, I really think the only way you're going to get ahead of the curve is if you truly do a lockdown for 2 weeks.
At one point, late Saturday afternoon, most of the ticketing lines for international departures.
Also today, the White House is expanding its travel ban on people arriving from Europe to include.
I'm just going to say, I don't know what's going on with this coronavirus stuff, but I think this shit was planned to try to kill people, because I feel like our planet is overpopulated. So I feel like they're trying to get rid of people as quickly as they can, or try to get people as sick as they can so they could get rid of. Like I always say, this is not God's world. This is the devil's world. So let's see if I can play something else here.
Hi, I'm Emily Landon. I'm a hospital epidemiologist and an adult infectious diseases specialist at the University of Chicago Medicine. I'm Allison Bartlett. I'm the associate hospital epidemiologist, and I'm a pediatric infectious diseases specialist here at the Comer Children's Hospital at the University of Chicago Medicine. We're here today to answer more of your questions about the coronavirus or COVID-19. So a lot of you have been hearing about this term that's called social distancing, which may be a new concept or a new term for some of you, but really it's an old concept. It is ways that we can all work together to spread ourselves out from other people and keep ourselves safe from spreading infection in large group settings. In an outbreak like this one, most people are going to be just fine. However, there certainly are a lot of people that are at very high risk. Even if you're not the person at high risk, the speed at which this disease spreads throughout our community makes a big difference in terms of how many people are sick at the same time. You know that in your own family, everybody can get a cold within a week or a week and a half of one another, and you can all end up sick at the same time. If that happens with our older and more vulnerable people in the United States, they could easily overwhelm our hospital system, and we may not have enough beds for all the patients that need to be cared for. In order to prevent that from happening, we all have to do our part to help spread ourselves out and slow the spread. When we talk about influenza, we usually use things like vaccines and antiviral medications to help prevent people from getting sick and slow the spread in our communities. We don't have that for this brand new disease, and more people than ever are susceptible to it. So what we need instead is for everyone to take precautions to keep themselves separated from every other person. You don't know when the person that you're sitting next to is going to get sick in 2 days, and then you might be at risk. This graph shows what happens when everyone gets sick at the same time. If we all keep going to the grocery store and the theater and spending time with our friends, and all our kids stay in school, and everybody keeps going to work and doing their lives the same way, then everyone will get sick quickly. Certainly we'll get through the epidemic more quickly, and that may be preferable to some of us. But if we don't slow things down, as you can see from this line here, it could be that there aren't enough hospital beds for when my mom and your mom get sick. Instead, if we do the things that we're talking about, like staying home from work and working from home when your boss tells you that that's a good idea, avoiding making extra trips out to do errands, spending less time in crowds, cleaning off surfaces, and all of the other things that we are talking about today, then we can slow the curve of the epidemic, and hopefully it will fall under our capacity so that our hospitals can keep being able to take care of patients that need us. So there are definitely different categories of ways that we can work together to practice social distancing. The easiest is, just as Dr. Landon has mentioned, to decrease unnecessary trips and running errands and staying out of large group gatherings. There are other things that we may implement that are working from home, which is, again, a way to keep yourself away from crowds. When you are working from home, you're doing exactly that. You are performing your work functions at home instead of going to your usual place of business. There's no other restrictions on your ability to go to the grocery store or to run the errands that you need to do, except that we do also want everyone to be mindful of all of the time that we're spending in public. Then we have patients who we are placing under what we call quarantine. So people who have an infection or have been exposed that we are having purposely stay in their house. They're able to work from home if possible, but limiting all of the other trips that they're taking outside of the home to go get groceries and run their errands. So I think there's a couple really easy things that we probably should have been doing all the time, but now really is our chance to show that we can shine in terms of helping keep both ourselves safe and, again, practicing social distancing and respiratory hygiene to protect everyone around us. So you've heard a lot about all sorts of new alternatives for the good old-fashioned handshake. So fist bumps and embracing the Vulcan myself, and elbow bumps, and any variety of other ways to greet people and acknowledge our relationships and community without transferring germs. I think other things that we can be doing much better are practicing our own good hand hygiene, not just after we're using the restrooms or before we're eating, but just regularly throughout the day. Keeping your work surfaces clean, wiping off your keyboard and your phone, and practicing good respiratory etiquette, coughing into your sleeve, using disposable tissues and throwing them away when you're done, and washing your hands afterwards. So we use the word quarantine in a really specific setting, and so usually your physician or the public health department is going to be the ones that are recommending the practice of quarantine. So quarantine is when you stay home, you aren't leaving for any of your errands, and you really are just staying in the same place for the entire duration of the quarantine period. With the coronavirus, we also have special recommendations for people who are living in the same household as you when you are quarantined, to help keep them safe as well as they help care for you.
So you see over there what these doctors saying. So like I feel, I'm not going to be on this video too long because some of my subscribers I've heard have said that some of my videos are too long or I repeat myself way too much. Sorry about that. Sometimes I have stuff on my mind, but I just feel like this. I feel like this coronavirus was planted here. They said it came from China, allegedly like 2019 or whatever. Who knows how long it's been around for? But I just feel like they've been planting this shit a long time. Just like I feel like they've been planting all these diseases that we have: diabetes, cancer, AIDS. You know what I mean? Syphilis, gonorrhea. I feel like all this shit's planted. And I'm not saying people can't be careful or shouldn't be careful, because they should be. But just like the doctor said, allegedly, just try to keep yourself clean. Hand sanitizers, wipe down your house if you have a place to live, and just make sure that your children are safe, and some of the children are out of school right now, which sucks because but I guess they're just trying to take precaution, I guess so. But yeah, I just wanted to say I feel like there's something's going on with this world. Corona, the devil's here, trying to destroy us. We can't allow that. But I just want everybody to understand that I feel like a lot of shit just isn't organic. I feel like a lot of this shit's planned. It's planned. Try to plan to depopulate, if that's right, or if I'm saying it right, or just decrease the life of human beings in this country, because there's too many of us on this planet. But feel free to check out my YouTube channel. My name's Russell Mills, RussellMills. My first video was Why Black People Settle for Less. So it's Russell Mills, May 22nd, 2017. Feel free to check out my YouTube channel. Everybody take care. God bless.